Okay. Good morning. Good morning. Welcome
Morning.
to the Mahogany Circle of Hope show. My name is Ameedah Hasan, and I am one of the co-hosts of the Mahogany Show. My other co-host is Gloria Bryant. Gloria, would you like to say hello?
Good morning, everyone, and thanks again, Tamika, for being on our show.
Thank you so much for having me. I do appreciate it.
Yes, we are happy to have Tamika Gant this morning as our guest. I will start this morning. I always say our mission and our purpose for the Mahogany Show. The Mahogany Circle of Hope show. Our mission is to uplift, inform, empower cancer survivors as they navigate life beyond the diagnosis. We create a safe and inspiring space where stories of resilience meet expert guidance on healing physically, emotionally, and spiritually. Through heartfelt conversations, practical wellness strategies, and a community first approach, we aim to support survivors in reclaiming their vitality, rediscovering joy, and thriving in their new chapter of life. We are also dedicated to information, resources to promote healthy communities by having different topics and different guests on our show. So, once again, you are here to experience the Mahogany Circle of Hope show. And today, our topic is health equity. And our guest is Tamika Gant. So, welcome, welcome, welcome.
Thank you so much for having me. I do appreciate it.
Absolutely. Gloria, you want to go ahead and get started with the interview?
Yeah, we're just going to jump right into this. Tamika, can you tell us just a little bit about yourself?
Yes, absolutely. I am a wife of 15 years. I have three beautiful children, all young men, and I am a registered nurse, also an entrepreneur, the owner of Abundance Health LLC. I am an advocate for my community. I also am a product of my community. And what I mean by that is I faced a lot of the inequities, a lot of the systematic racism, or even certain concerns or issues or challenges that the community was faced with. I was a teen parent. And this allows me to be a greater advocate for my community and really be able to serve them on a greater level in regards to the services that we provide. So our goal is to just be a light and lead people through the light to encourage them and lead to quality health care.
Thank you. So, can we get you to define health equity?
Absolutely. So one of the I think of health equity, I think of access. That's one of the words that comes to mind.
Hmm.
And when I think of that, what comes to mind is all individuals regarding their gender, nationality, their color, their sexual preference, or even economic status. Everyone should have access to healthcare and equally. It shouldn't be, in the face of anyone, not having access or just not having that opportunity to have that.
You, Amita.
Absolutely. Absolutely. So, some key concerns are what you just said: long-standing systems, racism, economic structures. Could you be a little bit more specific to show examples? Can you speak on that?
Yeah, absolutely. So all of these are barriers to individuals accessing quality medical services, healthcare services. And, I'm reminded of a time of this was actually the beginning of this year where there was a young child that was 15 years old and well, let me start over. I obtain and provide, let's talk about sex seminars. to combat the
Mhm.
increase of HIV that's going on within our Black and Brown communities, within our communities in general. And with that, this individual and his mother was brought along to my class that we provided in partnership with Gilead Sciences. During that class, they were present, and then a year later, they reached back out informing me that there was an episode of condomless sex where he was not protected, and they didn't really know what to do. So just being able to talk them through that process and show them what to do and how to do, and for them to go to their provider. And at that point in time, the clinic were closed, so they had to go to the hospital setting. They didn't feel comfortable doing that. I did go along with them. A lot of the time in these settings, I do not inform people that I'm a registered nurse because I want to see how our communities are actually being treated. And I
Mhm.
want to really see firsthand barriers that are in place because of gaps of health disparities. Um, Long story short, there was an Asian provider. I won't name the provider or the hospital setting, but there was an Asian provider that, and also a white nurse, and they were telling his parents not to take a medication that would prevent HIV, which is PEP, PEP.
Mhm.
And
Mhm.
during that time, I told them, well, this is what he's recommending. So I'm not sure on why he's not able to get this at the age of 13. Individuals have access to make sound medical decisions on their own. And they went back and forth providing all of these side effects, and it really wasn't that difficult. I mean, the chance of obtaining HIV versus acute kidney injury or whatever the other side effects they were referring to. And it was just really discouraging that this happened. Long story short, the boy did end up getting the medication and is not HIV positive, thankfully. But
Mhm.
these are just a couple of the healthcare disparities that our community is faced with. And just the different encounters that we observed with that was concerning as well. I also think about, just longstanding systems, racism, and economic structures being in place of this also with women having the highest rate of mortality, within the Black and Brown communities. This is unacceptable and it
Mhm.
cannot continue. I also think about Black individuals being seen within medical organizations or facilities and in relation to pain and their pain
Right.
not being taken seriously compared
Right.
to other white counterparts.
Right.
And I even see, even on social media, sometimes Black providers advocating for us as Black people or Black and Brown people about label your pain like this or say it like this or
Mhm.
say these type of words or this type of verbiage to actually get them to listen to what you're saying. This is really unacceptable and something needs to be done about it. And this is why we are taking the steps that are needed within the organization, within Abundance Health, to build up the bridge within the gap in healthcare disparities.
Hmm. Absolutely. You covered quite a bit. That's true. Because I think a couple of years ago, I think I saw something where the two young men who were sickle cell,
Yeah,
um, and they went to the ER, and when they in a crisis, you are in pain, and they
absolutely.
were refusing to treat the two young men's pain. And they would label them, oh, they drug seeking, but they didn't follow through and go through their chart and see that they had sickle cell and all that, and their treatment was delayed. So you're right that we got to do something about those barriers and stuff when it comes to pain and stuff. That's true.
And
That's very
that's
true.
even with I think with all sets of that, where you go in for pain, but you're not given anything because even with the older people, you're seeking drugs, and that should not be. That's just
Yep.
irritating. I mean, you're in pain as it is, and then
Yep.
you go in and they want to give you aspirin or something. Yeah, that's not acceptable. Shouldn't
Yep.
be in this day
Yep.
and time.
Yep.
Yeah, and I agree, and I've experienced it as well firsthand. and, labor and delivery. They waited so long to give me something. And,
Yep.
not having, anyone there to really advocate for me or really know what to do medically to advocate for me. I mean, I was the nurse, but I was the one in pain. So a lot of the time
Mhm.
when you're in pain and in such of a high stress environment, you're not really thinking straight either. So, it's just really unfortunate. It's really unfortunate.
So, I think that next one
Absolutely.
is yours, Rita.
So this puts us into determinants.
Mhm.
And when I think of social determinants, maybe I don't have the right. Could you explain that? Could it be economic or like I got this job, but maybe I really need to go to the dentist, but I don't have dental care. Can you talk about some of the social determinants or some of the barriers for the client that they're trying to process and stuff?
Absolutely. So, when I think of social determinants, I think of things that are not chosen, right? Sometimes we're just put in these situations not even knowing. Sometimes we're
Mm-hmm.
born into these. It could be,
Mm-hmm.
education,
Mm-hmm.
lack of education. It could be
Mm-hmm.
the neighborhoods that we stay in. And
Mm-hmm.
prime example of the primary communities that we serve is the east side of Tacoma. And that's
Mm-hmm.
specifically because it's like a healthcare desert, right? Like there's
Right.
the CHC that's there. And not only, medically, but even nutritionally, what other
Mm-hmm.
healthy food options do we have?
Yeah.
I also think of, economics, income. All of these play a part, and all of these also play a part in life expectancy, um,
True.
safety,
True.
education, and whether or not our communities are going to thrive. So when I think about things like that, these are all systems that are in place to specifically impact the Black and Brown communities. And I am a product of Eastside, Tacoma. It's where I live now. And, seeing a lot of the barriers that, this community is faced with when I first moved in Tacoma. First, we moved in Parkland, and then now we're in the east side of, more up along the east side of Tacoma. And, a lot of times when I first moved here, I was complaining. And after complaining for a while, I was just like, okay, complaints go so far. What are we going to do about this?
Mm-hmm.
So,
Mm-hmm.
and this is why, we provide many of our services specifically to East Side communities, East Side Tacoma, in relation to the healthcare disparities and the social determinants that are impacting our communities.
And Mary has a question. She said, "What role can healthcare professionals play in helping to close the health equity gap?"
I would say, um, regarding that, doing the work, right? Like
Mm-hmm.
a lot of times we talk about it, but what are we really doing? And
Mm-hmm.
what I mean by that is, for example, and I'm not saying that this is the only thing that can be done, but partnering with other organizations, creating
Mm-hmm.
community clinics, and that's what
Mm-hmm.
we are Men's Health doing with AIDS of Divinity. We
Mm-hmm.
are going to create, small mini clinics to provide access where it's free for people, where people don't have to worry about insurance being an issue,
Absolutely.
being
Mm.
underinsured, or, having a limited amount of insurance or no insurance at all, right?
Absolutely.
I also think about the BIPOC Health and Wellness Fair that we provide to
Yes.
the east side of community center. Our goal, excuse me, not east side of community center, the east of Tacoma and the surrounding counties. Our goal is to provide people with access. That is it. And when people have access, they are able to thrive. They are provided with the tools, resources, skills, knowledge that's needed to not only take care of themselves, but as well as their loved ones. So really, it's putting ourselves out there, really doing the work as community leaders, as first responders, taking the initiative, not waiting for anyone else to tell you to do it. Sometimes it's just you taking the authority that you have and moving on that.
Mm.
Absolutely. And back to the collaboration, all three of us belong to Leaders in Women's Health. And that's the collaboration and partnership is also can help. make the community thrive. But with that organization, the mission is breast health.
Yes.
Breast health. So now, we're able to get women mammograms who can't pay for them. So you're right. It's like you got to go to the people, not people trying to find you, but you have to go to them where they're at and stuff. And I guess I'm gonna jump down to Gloria, and then we can still, because this will still come in together as far as the historical stuff. But I kind of want to jump down to the data
Hmm.
in locality. Like you mentioned, East Side, and I'm
Hmm.
trying to think, where are there clinics on the East Side? I mean, I'm just thinking in my mind, do I know of any medical place that you go to on the East Side? Gloria, are you aware of a
I I'm thinking also, unless you go multi-care out further, would be in Puyallup, but
Walla?
I
Yeah,
think that's a good Sam. So I don't know of any right offhand.
They
but
Are
have
there any?
that's a long way too.
They only have now, I believe it's a newly built facility, but now they have CHC, so community health care
Mhm.
clinic. They have that with the Charlotte neighborhood, but
Oh, that's right.
a lot of
Oh,
people don't know about that because it's
That's
so
right.
far, within
Hmm.
that community where, I mean, if you're driving down the street, you're not going to see that
wouldn't see it.
That's
organization.
true.
You're not going to
That's
see
true.
that facility. So, there's even barriers within that. And, even with you bringing up, data on Pierce County and, other questions about, gaps and measurement challenges, because of the harm and trauma that was done within our communities, a lot of Black and Brown individuals don't want to participate in the
Uh,
data. They don't want to
That's true.
participate in that. And to be honest, I don't blame them. I
yeah.
understand. I completely understand. Um, and when we talk about just, data specifically in Pierce County, I do, work within the community related to HIV, in partnership with Gilead Sciences and Keepers of the Flame and things of organizations like that. I've learned that Pierce County has the second highest prevalence of new HIV cases. That
Wow.
is concerning. Um,
Hmm.
Also, within Pierce County, the leading cause of death within Black individuals and Alaska Natives, Native Americans, is heart disease. That's
Hmm.
a part of the 10th leading cause of death. And that's concerning. Um, and also think about, you know, um, the top 10 leading causes of death within Pierce County, with Pacific Islanders and Black individuals being the highest. And it's one thing saying that these groups have a high prevalence of diabetes, but this is a part of the 10th causes of death within that
Hmm.
nationality. It's
Hmm.
definitely a concern.
It
It is
is.
Definitely a
concerned.
concern.
It is. It sure is.
So I think about these statistics, and I think
Hmm.
about just the injustice that's done. And I also compared it to other white counterparts, and it's huge difference. And
Hmm.
some of
A
these
big
aren't
difference.
even, yeah, and some of these aren't even listed on their, you know, 1 through 10, leading
Hmm.
causes of death. And
Hmm.
this information is obtained from the Community Health Needs Assessment, as well as the Washington State Department of Health. So,
Hmm.
obtaining this information and knowing the statistics it's heartbreaking. It's
It
heartbreaking,
is.
and
It is.
it shows us that we have work
We
to do.
got work to do. Yep, absolutely. But you're doing it. You
Thank
doing
you.
it the best way you know how, and you are community based. Gloria, you wanna I didn't mean to cut you off, but I was just thinking on the east side. I don't recall seeing no clinics. I really don't. Going down Pacific.
But now that she said that, I do. I think we've been to that once before in Shalishan, but
Yes, I
you
have
forget
been there.
all
Yes.
about it because you don't see it
You don't
if you're
see it.
driving
Yeah.
down the street or someone didn't tell you
Yeah.
it was there.
Yeah.
So, do you want to speak on some historical and contemporary injustice? segregation, the Tuskegee. Do you have anything to speak on that?
Actually, I do. A couple different things. One of the things that come to mind that's more contemporary is a 12-year-old girl by the name of Kalani Balton that died in Renton, Washington at Valley Medical Center, urgent care. And this happened in 2021. She came in relation to an asthma attack, and upon being seen, there were wait times that on why she could be seen, and she ended up dying. And
Mm,
as a medical provider, if anyone comes in respiratory distress, they're seen immediately. That's
right.
not something that you
Supposedly,
just wait around with.
Right. That's
And
priority.
yeah, absolutely.
supposedly, Tamika, I went into the ER a couple of weeks ago with
Mhm.
my doctor had called and said, get in right away. You could be having a stroke or a heart attack because of some blood work. I sit in the waiting room for 4 hours before they even come, and I'm thinking, if they're telling me I could be having a heart attack, and you're sitting me in the waiting area, and no one's come out there to check on me or anything, this is ridiculous. This is totally ridiculous. So I did leave,
Yeah,
but yeah,
it's
You
sad.
know,
there's a lot of work to be done.
it
It's
is.
sad. It's sad. And it's hospitals and medical organizations that's right within our community. So
Hmm.
that's what makes it even more heartbreaking because these hospitals experience, quite a few BIPOC individuals that come into their organizations. And you would think that not even would think, there is education that's
Should be.
provided to these
Mhm.
Right.
medical providers.
Absolutely.
I've worked in the
Absolutely.
hospital setting. There's requirements for you to have certain education. There's nursing, credits that CEUs that are required for
Right.
equity
Absolutely.
and things of that sort. So, when it's not being taken, when it's taken lightly or it's not being put to use, these are things that are really discouraging to our community. Um,
Absolutely.
so that's, when you had mentioned that it's terrible. And also regarding the Tuskegee project, knowing that these men had to go through this for 40 years is
Yep.
insane. It's
I
insane.
think 1972 is when they finished. Now that let you know how long they was doing it.
Absolutely.
72, you
Over
know,
30 years. And
yep.
it's ridiculous how these men had to be subjected to this after there was a cure to it. But they lived it
Hmm.
out they made them live it out to see what the effects would be with being untreated. How
Mhm.
unethical is that?
Yes,
So these are all
absolutely.
disparities that play a part in why individuals of color don't trust the healthcare system. And I understand
Exactly.
that. I understand it firsthand
That's true.
because the trauma that's built behind this, and I think about syphilis and the effects of it, blindness that can happen,
Yep.
mental deterioration,
There it is.
you
Yeah,
know,
can affect your brain. Yeah.
paralysis, organ damage, all of these
Yep.
other aspects that really play a part in that. And it's disheartening to our
Yes,
community.
it is.
It's
Yep. And all
disheartening.
they needed was a shot of penicillin.
That's it.
They had a
That's it.
cure,
That's
but they
it.
didn't give it to them.
That
That's
is
true.
it. And,
Yep.
for them to be, saying they have bad blood,
Mm,
that it's ridiculous. It's
yep.
ridiculous. And, so I thought about some contemporary and some historical things that happened, and things are still happening to this day.
Today.
And,
Hmm.
it's still happening to this day, and it's really unfair.
It
And
is.
it's
It
really
is.
unfair, and I hear about, these things happening, often.
Yep.
We just have work to do.
A lot of work.
Absolutely. So, um, what do you suggest on how it can be improved? What are some of the ideas that you have that we can improve um, the systems or make it better where these barriers are not there? Could you speak on that?
Yeah, and that's actually a great question, right? Because this is how we actually get moving. This is
Hmm.
actually how we get moving. And I would say first and foremost is acknowledgement and taking accountability. That's number
True.
one.
That's true.
Acknowledgement and accountability for historical things that have been done, as well as contemporary and present things that have been done. The trauma, the injustice in relation to um, medical disparities and healthcare ailments, all of these things all play a part. And without individuals acknowledging that and taking accountability, it's like, where do we go from here if that's not being done? So a lot of
Absolutely.
times I apologize even for stuff that I didn't do, right? But I'm a part of the healthcare field. And this is
Mm-hmm.
what helps build trust, even
True.
within the BIPOC community, BIPOC health and wellness fairs I provide, right? So I'm building this bridge to 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 really bridge up these gaps, to really build trust within the community, the healthcare organizations, where people can have access to health and wellness. Um,
Hmm.
I also think about the state, the county, and other organizations really supporting and investing in community leaders that are doing the work. No longer can
Absolutely.
we dip into our own pockets to make this work for our community. It takes a village. It takes a
Yeah,
village. We
It
need the
does.
support that's needed um, to provide services for the community. We no
Absolutely.
longer can't do that. We need the funding to continue to be able to do the work, or work just won't be done. It just
that's
won't.
so true.
Absolutely.
That is so
Um,
true.
I also
Absolutely.
I also think about, showing up, just showing up, even if no one tells you to, just taking that leadership role and just kind of showing up, just doing what needs to be done. No one told
Absolutely.
me to, provide this health and wellness fair for the east side of Tacoma. I just seen a need and I went for it. Um,
Mm-hmm.
Absolutely.
and even regarding education, I provide seminars for the community setting. And no one tells me to do that, but I know that our community needs to be educated and
Absolutely.
a part of the barrier with individuals not having access because of lack of knowledge. So we just provide education in the seminars and the resources to get people the information that they need.
Absolutely. You said my favorite line, lack of knowledge.
It's in the
And
word.
that's, yeah, that's the word. No, I say that all the time. Our people perish due to lack of knowledge. And
Absolutely.
basically, that's what it is. I don't know everything either. So if
Yeah.
there's a condition, that's why we do the podcast. That's why we have guest speakers. Mary says, what message would you like policymakers, healthcare leaders, and communities to understand about the urgency of improving health equity?
It's
You kind
needed.
of talked about that already, but you can expand a little bit more. But policymakers, how can we impact that? I mean, yeah.
Absolutely. As I mentioned before, the investment, there needs to be more grants. There needs to be
Mm-hmm.
additional funding for
Yeah,
projects
Gloria says that all the
specifically
time. Yep.
policies for organizations that are just doing the work, for
Hmm.
organizations that are providing access to health and wellness. It's a limitation, and to be honest, a lot of the funding is dried up. So now this is impacting our community as a whole. And for instance, I provide these seminars. We're having an upcoming seminar. Let's talk about sex. I'll expand on that more later. But all of that is coming out of my own pocket. I'm not being
Mm-hmm.
paid for that. And I'm just not. And, but I have a passion for the community where it's just like, well, it needs to be done, so am
Absolutely.
I just going to sit back, and, I'm grateful for the position and influence that I've been given, to really make an impact for the community. And
Mm-hmm.
that's what I'm going to do. So, really, the policymakers and to other healthcare organizations and leaders, um, really assisting where it's needed, putting the money where the change is
Hmm.
actually
To
going to
go.
make a difference.
Absolutely. Absolutely. Yep, you're right. Absolutely. Well, I can tell you very committed and you're
Oh,
passionate about it.
we only have 10 minutes. So we wanted you to touch on long-term care before we have to leave. That's a big issue. That's a big
It
one
is.
for us. Can you touch on that a little bit?
Yeah.
Long-term
So,
care.
long-term care, it's needed, right? There's a lack of
Mhm.
individuals that are actually being able to afford it, right? I think about the individuals that are of older ages, and a lot of times they're not knowing what to do. And if they qualify for any benefits, it's like they have to sell their home, have to
Yeah.
have a certain amount of money within the bank account, so they have to empty their bank accounts.
Yeah.
And I just think about just how unfair that is, for them to
Very
give up
unfair.
everything that they worked for just to have access to long-term care, to be taken
Hmm.
care of in their older age. It's
Absolutely.
really unfair. It's not fair, but this is why we're partnering with DSHS to help do the work and provide long-term care benefits and application assistance to our community members, preparing them to for older ages. And you can start at any time, right? You don't
Mhm.
have to be a certain age. I also think of a lot of people in a lot of Black and Brown communities not really having access or the knowledge about life insurance policies or even
Absolutely.
about IULs, where you can access long-term care benefits at if you lose or don't have access to one of your activities of daily living, and
Right.
you're able to access that, or if you come across some kind of medical situation, ailment, emergency, sometimes you're able to, tap into that depending on your policy. A lot of people are not aware of that. So, it's really educating people, right?
Yes.
Mhm.
Where they can be educated on that. And, because we tell everyone to save, right? That's a huge thing. And I
Yeah.
think of health being wealth. And it's important. We need to save, but sometimes, are we putting our money into the right investments? Are we doing what needs to be done,
Absolutely.
especially to take care of us when we are older and in our
Absolutely.
long-term care ages?
Absolutely. Maybe later on, you said you're doing seminars. Did I hear you
Yes,
say?
so I was recently awarded a contract. It hasn't started yet. They said sometime within the month or so it is going to start. But yes, we are going to be providing seminars, where we provide long-term care application
Yes.
assistance and one-on-one
Okay.
assistance at the community centers and work source as well.
Okay. Please let
Great.
us know about that because
Yes,
we're in that, us three are in that criteria now. You know, I think about it. I say, I'm all right now, but what if something suddenly happens?
yeah,
I would be in that, I would be in that number too. So
yeah. I
we
would
need to know
absolutely
about
let you
it. But
guys
so
know.
definitely, Tamika, give us that information when you
Yes,
start the seminars. I would love to come
thank you.
and share with us your up and coming. I know you got two events coming. Share with us what Abundance Health will be having in April and in July.
Yes, so in April 10th at Eastside Community Center, we are having our Let's Talk About Sex seminar. This is in partnership with Gilead Sciences, and we are hosting an event at Eastside Community Center from 6 p.m. 7:30 p.m. It is going to be a dinner and learn type seminar where we will provide the food, we will provide gifts and prizes and swag bags and things of that sort. And individuals of all ages can come out and learn information about healthy sex practices, safe sex practices, as well as HIV and how to prevent it. A lot of people don't know about PrEP, PrEP, and PEP, PEP. So we
Mhm.
will be out teaching individuals on how to manage these medications, or even how to have safe sex practices and how to be healthy. So this is going to be at Eastside Community Center, April 10th from 6 p.m. to 7:30 p.m. And also we are having another one in Seattle for the ages of 13 to 17 years old at Rainier Beach Community Center on April 17th. And this is going to be from 8 to 9 p.m. So anyone from the age of 13 to 19 can come to the one at Rainier Beach Community Center.
That's awesome. I was
Mhm.
just getting ready to ask you about ages. So, but you clarified. That's
Yes.
great. That's
And we
great.
are also having our BIPOC Health and Wellness Fair, which is going to be July 25th from 11 a.m. to 2 p.m. at Eastside Community Center, where we will have over 60 vendors, free food, vaccinations. We are going to have dental assistance, all of the above. We just really want to provide individuals with a one-stop shop where they have one day of just equal access. So come on out, obtain information and resources, and prizes too. Last year we gave out We gave out some iPads, Apple Watches, and
Yeah,
gift
you did.
cards.
Yep.
And this year we hope to do the same. Last year we gave out 4 scholarships
Mm-hmm.
for Black and Brown individuals pursuing a degree in health and or wellness. We
Yep.
obtained the funding. We're hoping to do so again this year. So thank you so
Great.
much.
Oh,
Yeah,
absolutely.
thank
You're
you.
awesome to
Yeah,
me. You're doing a great thing. You really are, and we're
Thank
just so
you.
happy to have you here with us today. And I know people get tired of me saying that. I feel proud, and I'm glad to see the next generation to do community health. Me
Thank
and Gloria and Mary, we moving on, so we know it's in good hands now with you and Erica, Wanda, and Allie, all the next generation. You guys are out there in the community, and you guys are serving, and we appreciate you. We
we
appreciate your
do.
mission. So,
And I
anybody else have any questions, Gloria or Mary,
I
before
don't have
we
any
close
more.
out?
I don't have any more questions. I just thank you for all the information that you did give us.
thank you.
Absolutely,
And thank you guys for being the trailblazers to really make a trail for us to follow, a path for us to be able to follow and continue
absolutely,
this work. So thank you
absolutely.
for you guys and your services as well.
Absolutely. Mary, you have anything to ask Tamika?
Just saying good
Very good
information.
information. Very good information. I think you need a part two.
We
Yeah,
do need a part two because I
I
want
think
to go
so.
more
It's a
into
lot
the
more.
long-term care. That's what I like, the information on that and stuff. Well, I thought I heard you say you come out and you train the family for specific technical stuff that they're giving care to the family member. Is that what you said?
So that's along the lines of registered nurse delegation. So I have a contract with DSHS where I provide registered nurse delegation. So teaching the caregivers how to provide certain delegatable nurse tasks for them.
Mm,
That's nurse delegation. And with long-term care with Washington Cares Fund, it's going to be along the lines of teaching individuals within the community application assistance, one-on-one, and also seminars on how to apply.
absolutely. That now I think that's inventive. I mean, I think that's very creative. That way the client can stay at home if they need extra technical stuff. That that
Absolutely.
that's awesome. Yeah, that's very innovative. Well, we're gonna close out. Boy, this is a lot of
It
information.
went
I'm
so fast.
excited. Yes, thank you,
Thank you guys.
Tamika.
Thank
Thank you
you.
so
Thanks,
much. We
Tamika.
appreciate you and your commitment of what you're doing to make our communities healthy. Gloria, anything else before we close out?
Uh, we'll see you at the healthcare.
Yes,
Yes,
ma'am. We'll
thank you
see
guys
you at
so
the
much.
health fair.
Yes.
Absolutely. Absolutely. You have been listening to the Mahogany Circle show. Our guest has been Tamika Gant, BSN, CEO of Buddy's Health, LLC. And we thank you, Tamika, for being our guest. And everyone have a great afternoon. You have been listening to the Mahogany Circle of Hope show. Our platforms are on now. We're on YouTube. You can see the Mahogany Show episodes on YouTube, on Facebook, on Spotify, and on Radio Tacoma, which is Community Radio 101.9. So have a great day. Once again, thank you to me again for being our guest. Have a blessed day, everyone.